undergraduation is from Bangalore University and even post-graduation. Later, he moved to New Zealand, where he was head of faculty and academic research leader at a leading natural therapies college in New Zealand, Velpa College of Natural Therapies. Dr. Vijay Murthy has his master's in public health from the University of Auckland and PhD in health services research at the University of Technology, Sydney, Australia. He is visiting fellow, Faculty of Medicine, University of Southampton, visiting academic Australian Research Centre in Complementary and Integrative Medicine, University of Technology, Sydney. Dr. Murthy is an executive committee member and head of Ayurvedic Medicine Research Initiative, United Kingdom. Sir has a reputation as an exceptional teacher and educationalist across the globe and has seen all walks of life. Dr. Vijay's education and clinical background covers all the ends of the world: India, New Zealand, Australia, UK, and USA. We are very glad to have internationally highly reputed repertoire of knowledge and skills, Dr. Vijay Murthy, as a resource person. And with great reverence, I welcome Sir for this webinar, who will be speaking on the post-operative management of Agni, utilizing gut microbial and GI function testing. Over to you, sir.
Thank you, Dr. Krishna Prasad. I hope you all can hear. If you don't hear, do message.
It's loud and clear, sir.
Okay, thank you. So I hear that, you all can hear, so let's get going. First of all, I'm really pleased to be speaking at a Shalya Tantra conference, largely because my postgraduate studies was in Shalya Tantra. But what you're going to be hearing today is not so much going to be related to Shalya Tantra, but linked to it. And I'm going to explain to you the reason why. And this current webinar is on Anushastra. And of the Anushastras that I have utilized or have been using in the UK is, of course, Jalauka. Before I start my PowerPoint presentation and share some of the test results, which I think are so important, I'd just like to share with you that what I think is, in the 1990s, when I was educated in Ayurveda, we were educated almost in a very similar way to the allopathic curriculum, where we studied specializations to become specialists of a particular skill. For instance, like if you did your post-graduation in Shalya Tantra, you would have to really be very good at the procedures of Shalya Tantra and almost becoming a specialist in a particular surgical condition or a condition that could be treated surgically through Ayurveda. But what's happened, I must say, in the world is that we have understood the limitations of specialization. Expert knowledge and having an expertise in a particular specialty, be it allopathic or Ayurvedic, is crucial. But when it comes to practice, we cannot take a very reductionist approach of I only do Jalauka Charana, or I only do Agni Karma, or I just do Kshara, or I just do Shastra, Chikitsa, or parasurgical procedures. While we could all be very passionate, dedicated experts in the benefits of a particular skill, like Jalauka Charana, only because we do so many of them that we understand the effect of it in different cases. Essentially, As Ayurvedic physicians, we must remember that Ayurvedic practice is holistic. The strength of Ayurveda is in looking at an individual as a whole, in understanding the functions or the dysfunctions in different systems within the body and mind, of course. So, this systems biology approach is the unique strength of Ayurveda, which you and I, as Ayurvedic physicians, should never forget. Even if I'm highly specialized in one particular technique, to reduce Ayurvedic practice to a technique would be a great disservice to Ayurveda, especially if we are trying to recollect the tenets of Ayurveda from the classics like Charaka or Sushruta Samhita, where the treatment has to be always about Samprapti Vigatana. It has to be about reversing what caused the disease as opposed to managing the symptoms. I'll give an example to you and I'll keep coming back to this because I guess what is very important while we become specialized in a particular technique is never to give up the whole Chikitsa principle or Chikitsa Tattva of Samprapti Vigatana, to reverse what caused the disease, to look at the dysfunctions which led to the manifestation of a disease. And, fortunately, we today are in an environment where, because of extensive research which has happened in understanding the imbalances in the functions, which then leads to a disease, we are able to even measure that. And I hope I can share some of how I practice by utilizing these functional tests that can help in doing that Samprapti Vigatana, while we still focus on conditions which can be treated surgically or by using the Ayurvedic parasurgical methods. I'm going to be sharing my screen and my very interesting experience, which led me to not just focus on a technique, but to be focusing on the entire individual, started with my journey of treating a case of psoriasis. As you can see, I hope you can see this image. As you can see, the skin is inflamed. You can see the silvery flakes, typical lakshanas of Kitiba. And this patient has had psoriasis for more than 16 years. And obviously, the manifestation of psoriasis was in the usual places where psoriasis is predominantly seen or tends to express. So I utilized Jalalka, and maybe you would be interested in kind of trying to understand how does Jalalka Charana happen or work in the UK. Well, first of all, you need to have a special license to be able to do any bloodletting therapy, including utilization of leeches. There are health and safety regulations. You need to have an insurance. You need to have a license. And I was really looking for where can I get the Jalalkas from? And obviously, the Jalalka or the leeches that we use in India are quite different from the ones which are found generally in subtropical or cold countries. It's not the same. So I had to look for a bioform who produced or who grew tropical variety of leeches. So I then had these leeches, tropical variety of leeches, being couriered overnight from the farm to London. And then I started using it for bloodletting. I must say, while Jalaka Charana has had an amazing effect in terms of improvement in symptoms, the symptoms relapsed. And this is where, it is very important for us not to just focus on a technique, but to go back to what Sushruta in Sushruta Samhita has described, that you would need to do Shodhana before any of these Shastra karmas or even Anushastra karmas. Obviously, I'm not just talking about the karma, but you are going to treat a person with a condition. You're not just going to, I mean, if it is just removing a mole, removing a wart, that's completely different. But if you're treating conditions where Jalauka Charana or any other Anushastras is of benefit, we should not just focus on symptom management, even if the effects are going to be quite good initially to reverse the condition. So what I do with my patients now is, even if I'm very tempted to do Jalauka Charana, to do bloodletting, I would assess my patients' Agni, their Dhatus, and do a proper case take to correct their Agni, to correct the Ama, to possibly do a Shodhana where possible, where it is indicated, and then to use Jalauka Charana at a later stage. And also after any of the surgeries. For instance, it is very common here that people have had undergone a surgery. It could be for tumors, it could be for different operations. But what generally happens, as we know, in conventional medical care, once the surgery is done, it is really about seeing that there is no infection and that the surgical wound has healed properly, and that the person is ambulatory and there are no complications, and then nothing else is done later. That's where our work, or my work, begins, is really post-surgically also to, or post-operatively, to look at the gut function and to treat that. Something that I'd like to really emphasize is that no matter what we do as an Anushastra procedure, we must all go back to the fact that all diseases, they start due to dysfunction of the gut. Hippocrates said, death begins in the colon. When in doubt, treat the gut. So when in doubt, or as a very starting point to any treatment, I would always start with treating the gut. But then what is treating the gut? Because we are all Ayurvedic physicians here, we would start with Dipana, Pachana, and maybe Anulomana, Virechana. But how do we know what that person's Agni is like? Because my biggest question to me, maybe some of you are cleverer than me and you can figure out whether your patient's Agni is Vishama, Sama, Tikshna, or Manda. For me, while theoretically I can think of, okay, this person has Manda Agni or Tikshna Agni or Vishama Agni or even Sama Agni, I go back to what Ayurveda says, which is about you have to understand the function of the Agni or the status of the Agni through Jarana Shakti, through their digestive ability. This is a very difficult concept to quantify. How do I know that someone's Agni is all right? Because their digestive functions are fine. Like they have got good appetite, they've got good hunger, they don't have bloating, they don't have acidity, and their bowel movements are regular. Can I then assume that, yes, their Agni is fine because all their digestive functions are fine? But unfortunately, that is not true. While that may be true, if you're treating a condition where the person already has digestive dysfunction, like IBS, but that is not what would be truly the assessment of Agni. Because if we are looking at the trajectory of disease development, where it has to start with Agnimandya, then there must be Ama. I mean, there is Dosha Vaishamya, Agnimandya, Ama, and then the vitiated doshas must traverse through the systems to find a vulnerable spot, Kavaigunya, where the disease has to be manifested, which is also true in all or most of the conditions where surgery could be useful, other than road traffic accidents or other kinds of impact injuries, where the condition or is due to a change in the internal system of the patient. And like today, we live in a world where measurements are very important or very helpful. And can we measure someone's Agni alongside assessing their Agni through a regular clinical observation? And this is where I have discovered through functional medicine the importance of understanding gut functions. And the most important difference that I find when I look at those who recover from psoriasis for a longer period of time to those who do not recover from psoriasis for that length of a period is really the difference in their gut microbiome. And with this patient that I was treating with Jalapacharana with for psoriasis, when the initial sessions for about 5 times were done, there was an amazing result. But then the symptoms relapse within about a month or within about 6 to 7 weeks. Then you start questioning, was Jalapacharana not effective, or why has it returned? So you would have to actually correct the causes. You can give Ayurvedic remedies or Ayurvedic medicines, which are Shamanaushadhas, but would that be the right way to treat it? Is when I started asking myself, okay, let's understand the Agni of this person. Clearly, the person's appetite was good. There were no digestive issues. There was no bloating. There was no heaviness. There was no acidity. The elimination was fantastic. The person was going to the loo every day. The bowel movements were clear. Also because, this person was on anulomanas like Triphala regularly, and it all helped. But yet the symptoms were relapsing. The flare-up was very high, despite him responding to Jalapacharana. So that's when I discovered looking for understanding the gut microbiome. So let me spend a little bit of time really in this presentation to talk about how we can test the Agni from a more scientific perspective, utilizing more scientific aspects that are available today. As we know that the human gut, in fact, the human gut or the human body is a shelter for many types of microbes. And these microbes, some of them are useful, necessary, and some are potentially pathogenic. And when there is a variation between pathogenic bacteria and healthy or commensal bacteria, this is when the disproportion in the population of healthy and unhealthy gut microbiome, that can contribute to inflammation. What I generally see in conditions like psoriasis or other skin conditions like eczema or lichen planus, in many of these skin conditions, where patients are given corticosteroids or they're given certain kind of moisturizers, it all kind of has a very temporary relief. What I'm trying to say is, if our patients are getting relief through topical applications of conventional medicines, and if they are getting similar relief through Jalauka Charana or bloodletting, But if the symptoms are relapsing, either through conventional dermatological treatment or through Ayurvedic Anushastra treatment, what is that is going to be of advantage? Maybe you could argue that, okay, they're not using corticosteroids, so hence you are not interfering with their body's natural healing ability or body's immune system. But by using Jalauka, you are unlikely to kind of interfere with the person's immune system, which is already good. But if the symptoms are relapsing, as you know, scientists, you would ask, what is the greater benefit of Jalauka Charana if a corticosteroid can give the same effect and if the symptoms relapse? That's where the Ayurvedic concept of treating the whole person and treating the Agni is very important. So I guess what I'm trying to emphasize is that because I'm specialized, or you are specialized in a particular technique, we cannot actually forget treating the Agni, and that becomes equally important. And understanding the Agni is also equally important. How do we do that? And I'm going to share my experience and how we possibly, you possibly also can start to look at it. So let's go back to a little bit about, how to understand Agni. Obviously, when it comes to understanding Agni, we are always interested in understanding if there is ama or no ama, presence of ama or absence of ama, or what are the ama lakshanas. Unfortunately, it's very hard to exactly quantify the lakshanas unless you are a very skilled clinician, or unless your patient is so very aware that they can describe to you the lakshanas which you cannot observe through prashna. But these tests will help. See, getting to know our gut microbiome, a huge quantity, hundreds of trillions of bacteria and other microorganisms inhabit our intestines, fulfilling key functions for our health and well-being. And so gut microbiota, the weight of gut microbiota is about 1 to 2 kgs. So like I weigh myself quite often. And then like today I was 74. So I could almost imagine that of that 74, 2 kgs of that is really my gut microbiome. 95% of our own bacteria is located in the gastrointestinal tract. So the important part is when it comes to Jataragni or Agni as such, Koshta, the most dominant contributing factor to influence one's Agni is the gastrointestinal tract, because 95% of our gut microbiome is located in the gastrointestinal tract. So bacteria are 10 to 50 times smaller than human cells. So they are able to traverse through the pores which human cells themselves would not be able to due to the barriers. So the movement of bacteria, whether it is healthy or unhealthy, is far greater because of their size. So in our body, microbes outnumber human cells. So we have 10 times more microbes than the number of human cells. So that's the importance of, let's say, for the want of better word, if you want to argue there's no such thing or there is such thing, krimi. And if we can just imagine the magnitude of how important microbiome is, the gastrointestinal tract surface is as big as 2 tennis courts. So if you lay 2 tennis courts side by side, that's the surface area that our microbiome would occupy. So laid end to end, our body's bacteria would circle the earth 2.5 times. So we can't really ignore this. And when it comes to the number of functions that gut microbiome can affect, immunity, absorption, metabolism, chronic conditions, inflammation, and mental health or behavior. I'm just going to focus on the conditions which are relevant for us as practitioners of Shalya Tantra. Definitely, we would have to look at inflammation, because most of the times, the reason why at least my patients, they come to me is because of unresolved chronic skin conditions. And there, what seems to be the underlying factor is inflammation. Inflammation not only of the region where the lesions are, which obviously would be, but an underlying low-grade inflammation in the gut, in the mucosa, in the shrotases, in the annavahashrotas. And also, a lot of the times, their immune system is compromised. And, currently talking about COVID, we just have had some bad news this morning of a very well-known Ayurvedic physician who I had known when I was studying, who has just passed away. I just couldn't believe that this person who was hale and healthy just passed away, and COVID. And my friends have been telling me it's because of COVID. I'm yet to understand, what is the exact link between the cause of death and how COVID is linked. But however, we all know, even the general public know, that the most important thing is the metabolism. And I'm, coming back to our topic, see, whether we are Shastra Chikitsakas or practitioners of Shalya Tantra, we cannot forget these two concepts of inflammation and immune system. And if I have to kind of look at it in a much more objective way, when I'm testing someone's Agni, or whether that has healed or is it in a right environment for healing to occur even through Jalokacharna, I would have to rule out how their immune system is and how their inflammation is. And through doing a gut microbial testing, you can get very valuable information about one's inflammatory status and also one's immune system, amongst many other things. So if you really look at this picture, I hope it's big enough on your screens. If not, listen to me. So there are 5 factors that we need to be looking at when testing for Agni. And I do this pre-operatively and post-operatively. And don't get me wrong, it's not that I would be doing the surgery, because I can't, I'm not licensed to. Even if they're undergoing surgery, even if they're undergoing any of these procedures, even like, parasurgical procedures, which would need repeated procedures, I would make sure that in the background, I maintain their Agni well. And these 5 factors are maldigestion or absorption. Secondly, inflammation. Thirdly, infection. What I've found in my practice, which I'm going to share very shortly with one of the reports, which is not through a stool test, but through a urine test, how you can actually understand if there is fungal overgrowth or bacterial overactivity, which could be contributing to non-response to your bloodletting or other treatments like Jalokacharna. The 4th factor is dysbiosis. Dysbiosis is if there is excessive population of unhealthy microbiome, unhealthy bacteria. The 5th factor is metabolite imbalance. Like our body, whatever it is exposed to, the food or environment, it has to be processed and it is thrown out. Like I find this concept so very interesting, because I couldn't have understood this concept when I was in BA MS, where we studied dosha dhatu mala mula hi deha. So we can understand the concepts of dosha, dhatu, and mala, but how do we actually examine the functions of dosha, dhatu, and mala utilizing certain scientific testing is what now I'm excited about, because even mala. Let's think about metabolite. See, if we are looking at a comprehensive stool test, which is what I do very often, you are getting very valuable information from the stool testing, which is not just to detect parasites, which is what, was happening through conventional medical testing, is to look for parasites. But our stool can give a lot of information about how our body is throwing out what it is processing. So that is the metabolite imbalance that we would be looking at. So these are the 5 functions that I look at. How is there absorption? Is there inflammation? Is there infection? Is there dysbiosis or metabolite imbalance? I think what I should really do now is, to stay with this particular slide, and then I'm going to take you to some of the reports. So bear with me. I'm like kind of trying to use this PowerPoint and also some of the reports, but I hope you're getting an idea of my chain of thoughts. If not, please do in the chat box ask questions. I'm currently not able to see anything as I'm only seeing my PowerPoint. So if there are any questions, please, the moderators can just stop me and say, let's stop for a while. Let's deal with these questions and go forward, or I could complete my presentation, and then we will have enough time for questions and comments. So with this particular slide, what I'd like you to see is this study was done in Netherlands, and what they were looking at was what is the difference in individuals' responses to the same kind of treatment. So let us say, this was not about any of our treatments. Generally, those who are on medications. The inter-individual variability in responding to any particular treatment was 19% was based on their difference in the gut microbiome. So like 12% was the diseases that they had. 31% was host characteristics, which we could say is like Prakriti, if you want to make a comparison. 60% was their dietary factors, which we all know that, ahara and vihara, ahara is very, very important in actually changing the way how we respond to any treatment. And 4% was related to those who were smokers, which is understandable. 19%, which I think is a significant percentage, 19% was really the way somebody responded to a particular medication depended on the difference in their gut microbiome. So what I'm trying to encourage you is to understand the magnitude of how our Agni, or if you're looking at it from a more scientific perspective of gut microbiome, how that can be the determining factor in you of getting results with any of your Anushastra treatments, particularly, I would say, Jalapacharana, in skin conditions. Now, what I'd like to do is take you through some of the reports, and let me, okay. So what we do get is, I hope you can see this, what we do get when we do a comprehensive stool analysis is we can look at the scoring. The scoring in this person, see, absorption is perfectly fine because the score is 0. If it is less than 2, then there is need for digestive support. The most important marker being pancreatic elastase. If pancreatic elastase is low, then I would definitely think, there are problems with the absorption or Jataragni. And that's where I would be using more Pitta Vardakas or Pitta Rechakas. Let me just look at, if there's anything I need to look at in terms of the chats, and I don't see anything. So I'm going to carry on in the chat. Okay,
Sir,
so there
only I
are,
will be getting the chat messages, sir. I have
oh,
changed the settings only for the host.
okay, okay, thank you.
I'll ask you with the Q&A at the end, sir.
Sure, no worries, thank you. So, see, in this person, the pancreatic estrase was normal. The products of protein breakdown was normal. And the products of fecal fats or fat breakdown was normal. So to me, this gives me an idea that there is no absorption issues because the score is 0 in this particular patient. But if it's less than 2, there's very low need to support the digestive functions. What you do see is inflammation, which is like a 2. 2 to 3 is optimal need for support. So what I do see in this person is there's an eosinophil protein which is in excess, which means that probably there is intolerance to certain kinds of foods which would need to be addressed, but the rest of it are all fine. But when I look at the need for microbiome support, dysbiosis, this is really the one that needs the highest focus because the score is 7. So while the absorption is fine, there is less of inflammation, of very mild inflammatory factors, and there is no infection. Like there is no bacterial, fungal, or parasitic infection in this person. The only thing which really needs attention is the dysbiosis or the unhealthy population of gut microbiome. So if I quickly go here, see, can you see these 4 zones? So on the x-axis is inflammation and on the y-axis is immune suppression. So if through doing a stool analysis, if I find that somebody is in zone 1, that means there is very less inflammation, very less immune suppression, which means that the Agni is Sama. And when I find this, I feel that if I have corrected this person's Agni and still the skin condition hasn't resolved, then I would be using Jalapachara. And say, if for instance, the where it says U, which is that patient's gut microbiome, where they in zone, if it goes to 2, then I would know that there is some immunosuppression. You know, this is where the Agni could be all right, but the immune response is not good. So this is where I would be supporting them to boost their immunity so that the immune system can become a lot more resilient. But when it comes to zone 3, you can see that there is higher amounts of inflammation, higher amounts of immune suppression. So this is where the Agni is really pretty bad. And that's where you would need to treat the Agni very intensely while you're focusing on your other treatments such as Jalapacharana. If it is in zone 4, again, there is a very great amount of inflammation. So until you treat the inflammation, even if you're doing Jalapacharana or other Anushastra treatments, your response won't be that great. So if you look at this one, the commensal balance. So what is commensal balance? Commensal balance is healthy bacteria. So we all have healthy bacteria and unhealthy bacteria. When we look here, if it is in the green zone, then that's balanced in the sense this individual has really healthy bacteria. And, you know, generally what I see is when it comes to making dietary changes as well, the people who do not have healthy bacteria are the ones who would be eating out a lot, having lots of takeaways, having lots of fried foods, are the ones who eat pre-packaged foods, are the ones who hardly get any fiber. You know, like whether it is Western diet or Indian diet, if our plate is largely filled with carbohydrates like rice or other simple carbohydrates and less with vegetables, less with fibrous green leafy vegetables, clearly that would accumulate on a daily basis and result in very poor gut microbiome. So what I'm trying to emphasize is that while we can focus on our very unique skill of Jalauka Charana or Agni Karma, we have to also pay attention to our patient's diet and lifestyle should we want sustainable results while we are using these Anushastras. In this person, as you can see, this person is somewhere borderline to imbalanced, almost kind of beginning of an imbalanced state of commensal bacteria. So, I mean, this is a fantastic test which gives you exact details about every aspect of their microbes. But, whereas if I just do the parasitic infestation, then I would not be getting all that. But in this test, I also look for, are there any other nematodes, cystodes, trematodes, or protozoal infection, or in any other additional kind of infections. So what I am trying to say is, we should not forget that the beauty of Ayurvedic treatment of any condition is really about treating the whole person. What I generally do is, if someone has chronic skin condition, which isn't resolving through trying different things. Some of my patients have done Vamana, Virechana, the whole battery of Panchakama every year, and yet there is relapsing psoriasis. And this is where I would actually go much deep into measuring markers that would give me an indication of their Agni and Ama. So initially, I would do a comprehensive stool analysis, like the one that I just shared with you. And once I have given the treatment, then I would look for the metabolites. Like, let's go back to what I was saying before, is mala itself can give an amazing information, what the body throws out about how the body's functions are. So you can infer through understanding the functions of the mala, the functions of the doshas and dhatus. And I use organic acid test. And this organic acid test is a urine test. So there are about 72 organic acids that you could test. I mean, there are many organic acids, but in this panel, I would test 72 different organic acids. Not that I test it, I send it to a lab in the US and they test it and send the reports to me. Let me share the kinds of information that you can get, in through this organic acid test. This might be very small on your screen, and I totally appreciate that if it is small. But do have a look on to my left-hand side. When I'm looking at the computer, you can see the numbers 1, 2, 3, 4, 5, 6, 7, 8, 9, right? You can see up to 18. So what we have are the yeast and fungal markers. And you can see, when you see these bars, so there is the reference range. And this is the median. And if the markers are within this reference range, that gives you an idea about their fungal overload or bacterial overactivity. But if it is too low or if it is too high, as we can see in some of these, that gives us a very clear idea about whether they have a fungal load. I've often found that with my patients who have skin conditions, not just psoriasis, it could be eczema, it could be lichen planus, or it could be a very simple form of dermatitis which keeps recurring. Instead of being very tempted to do Jalauka Charana, I would either initially or afterwards try and assess if I've corrected the Agni. And with this organic acid test in this person, as you can see, there are at least 1, 2, 3, 4, 5, there are about 4 yeast or fungal markers which are really high. And some of them even suggesting possibly aspergillus fungus. So there you would have to treat the fungus. So what I've found is, see, when you are treating a skin condition, we always assume that it is due to excess of pitta vitiation, and therefore we need to do pitta hara. But what is important is that when you're correcting the Agni and you're doing Pittahara, you would have to be very specific as to how you can correct someone's Agni, which does not result in aggravation of Pitta. To me, this whole concept is really not by just simply going by, okay, let's use garlic, and garlic is Ushna Virya, therefore it is Pittakara, so you shouldn't be using garlic. I wish practice was that simple, that you could just take one dravya and talk about its guna being Ushna and therefore you can't use. That makes an interesting discussion theoretically, but in practice, if you want to change someone's Agni, you may have to actually change their Agni by using Ushna Virya dravyas. For instance, garlic. In this person, when I use something like garlic, which is a very powerful antifungal, and take away sugars, which is equally important, then that the fungal load comes down. The problem that I've found in practice is you use medications to correct someone's Agni, but if their consumption of sugar, if their consumption of anything which gets converted into sugar, including excess amounts of carbohydrates, you basically are contributing towards inflammation, which means that you are contributing towards ama from an Ayurvedic perspective. So it's so important that while we focus on a condition based on doshas, we must also think of how to correct their Agni and what to use to determine for me if this person benefits from garlic or not. If this person has yeast or fungal markers which are very high, I would use garlic. And still the skin condition won't get worse. The skin condition actually gets better because you are treating the fungus. Whereas if I am not doing this and simply using Ayurvedic medicines, I won't have any clue actually what is working and what is not working. And so this has really helped me to focus my practice to make it very personalized, and also to make it really scientific and you can measure. And for me to better understand Ayurvedic concepts as well, as I've been explaining to you. Like I kind of understand now, why dosha dhatu mala mula hi deha. What is samprapti vigatana? Samprapti vigatana, we can picturize it, but how do we actually do it in practice and measure it? These functional tests have been really trying to educate me to understand Ayurveda better than what I did when I was studying Ayurveda in the initial stages. And in this person, you can also see that there is bacterial markers, like hippuric acid is very high. What I found very interestingly through doing these organic acid tests is that when the fungus is high, it is very likely that the bacterial activity also becomes high. But if you just treat the fungus, like if you just treat fungus as an ama, the bacterial growth also becomes increased. Therefore, you would have to use a natural or an Ayurvedic antimicrobial alongside using an Ayurvedic antifungal. So that is something that I've found in my practice to be of value, when to use an Ayurvedic antimicrobial, when to use an Ayurvedic antifungal. Like when I think about Krimignas, a lot of them are antifungal and antimicrobial. So when I'm choosing which one of them to use, these tests will give me a fair idea about how to go about it. And you could also look at, Clostridium species, which is also high in this person. And something else which may be not directly related to this topic, but could be of interest is I also study the energy conversion pathways. And the citric acid cycle or the Krebs cycle, which we all studied in our first year, and then we passed the exam and then we forgot. But it's so important if you are trying to understand how our dhatus are functioning from a scientific perspective to get an idea about how someone's citric acid cycle is. In this person, as I can see, because of excess bacterial activity, because of excessive fungus, that what it has done is the citric acid cycle is forking towards producing more oxalic acid and more oxalates. What fascinates me, again, like as Shalya students or Shalya scholars or practitioners, one of the things that our patients do come to us is for treatment for renal stones or kidney stones or urinary stones. And often they undergo this surgery, and then again it relapses. See, it's initially surgery might be quite a relief, but then as it keeps relapsing, patients actually want to do something which is more conservative or non-invasive than doing something which is invasive like Shalya. And what I found is if their fungal growth is high, there is excessive bacterial activity, particularly if the fungus is very high. Candida in the gut, not candida as seen in the nails or as vaginal thrush or thrush in the mouth, but candida in the gut, which is what we are detecting here, is that their oxalic acid activity becomes very high. And when the oxalic acid activity is high, that also can contribute to formation or relapse of renal stones. So when I try and understand this and correct their Agni, reduce the oxalic activity, then you can expect a more sustainable result for the treatments that you do in terms of preventing relapse. And most of you will understand that there are many conditions that you and I see which can be treated through Anushastra or the Ayurvedic aspects of Shalya, are the ones which are Kruchra Sadhya, or they are Yapya. But then to have that longer periods of that disease not expressing, we will have to correct the Agni. And these tests for me, they really help in making it very personalized. It's like really shooting at the target, not just like shooting in the dark and believing that it is going to work. And this is where we see the difference. One patient responds to a treatment and another patient doesn't respond to a treatment, then we would be thinking, oh, why is that? I use the same medication, like even I discuss very often with my friends from India, what do you give for this? Or can I use this? But believe me, what may have worked for your colleague may not work for your patient. Often it is the case. I've seen this in Shvitra, like some of the best Ayurvedic physicians who are my classmates from India, they have amazing results in some skin conditions. And I use the same. There are results, but not so amazing. But then I use something very simple. I get amazing results. So how do we as physicians try and understand the difference of why we might be getting a better result or not? Besides, we could always at the end say it is your hasta guna, which is always there because, that is there. You as a physician has an influence. I totally agree with that. But besides that, if you're looking at it more objectively, these tests actually can help. So if I'm correcting the oxalic acid activity, if I'm correcting their Krebs cycle, reducing the sugars by giving them antifungal, natural antifungals from an Ayurvedic perspective, and natural antimicrobials or antibacterials, which is what I would say is as correcting their Agni and removing the ama, then I would see that the results are far better. So what I'm going to do right now is stop sharing the screen and then come back to the regular mode. As I said in the beginning, I'm not a specialist who uses certain procedures of Shalya Tantra because I was trained in Shalya Tantra. I like to see the person as a whole. And I'd like to utilize Anushastras, particularly in my case, Jalauka is the only thing that I can do. And that's one that I'm familiar with that I can do. I would look for what are the factors I should be considering before jumping into the decision of doing Jalauka Charana. Or even after doing Jalauka Charana, what are the factors I should be assessing and measuring? And to me, ultimately, I have come to the realization that everything comes back to your gut health. And everything comes back to treating Agni at the level of the gut for results to be sustainable. And there are ways you can measure it. There are more ways to measure someone's Agni and Ama besides the theoretical aspects, or even looking at someone's tongue or doing a case history. And we are lucky that we are in a time where we can so very well integrate Ayurvedic concepts and Ayurvedic practice with cutting edge scientific tests. I mean, these tests are not something that is used by conventional medical doctors. These are not conventional medical tests. These are more elaborate, specific scientific tests utilizing organic acids in the urine, or testing for organic acids in the urine, or a comprehensive stool analysis. I do understand that, you know, these tests may be new in India. They are very expensive because there are only few people who are doing it. But what I wanted to share with you is I just wanted to give you a glimpse of how I practice or utilize what I've learned through my Ayurvedic studies by integrating that with everything else that I do, and particularly in my integrated practice of functional medicine and Ayurveda. So that's probably all that I would be able to say on this topic. I really would like to open this up for comments and questions if there is enough time left. So I'm going to pass this on to the moderators of the webinar. Thank you.
Thank you, sir.
You're most welcome.
Sir, we have few questions. Shall we take it up, sir?
Sure.
Yeah. So one is, you were telling about the parasurgical procedures and their probable relation with Agni in the few slides. So how do we correlate it, or actually the question is like that?
So I would just, go back to saying the same thing is Ayurveda is a whole system. And Ayurveda has never been meant to be practiced as specializations. Yes, we do acknowledge that Ayurveda has special knowledge and skills through its Ashtanga. But I strongly think that thinking that Ayurveda's 8 branches or 8 specializations is a total, it comes from a very Western allopathic way of thinking. Because when Ayurvedic syllabus was done in India, it was very much to look like MBBS, very much to look like we are also like MBBS doctors. And in that, what we did is that we really kind of utilized Ayurvedic classics to interpret it in a way that we also sound like we are allopathic doctors. There's nothing wrong. Expertise is excellent, whether you are an allopathic doctor or Ayurvedic doctor. But what we forget is that, this is something that I'm also always surprised. This could be quite controversial. Why is that somebody who has a post-graduation in Shalya Tantra can never become a lecturer in basic principles or teach something else? Because that's a very allopathic way of thinking, which is about the job. It is not about practice of Ayurveda. Sushruta did not say that I'm going to only do Shastra Chikitsa. I'm not going to be considering Agni or Ama, or I'm not going to consider Shodhana. If you really look at the classical way of thinking, it was all about really treating the whole person, taking a whole system approach, which I feel we are missing as modern Ayurvedic doctors. We are trying to mimic allopathic doctors, saying that, I'm an obstetrician, I'm a gynecologist, I'm a surgeon. Yes, we have expertise or extra training in that. But to be a true Ayurvedic physician, we would have to actually treat Deepana, Pachana, Snehapana, Birechana, Anulomana, Shodhana, Shamana. And in that way, that's where I feel that even if I'm an expert or you're an expert in a particular skill, you cannot ignore the Agni. You cannot ignore Ama. Until we correct the Agni and Ama, any treatment that we do with our specialist skills would not give the same sustained result.
Yes, sir. Thank you, sir. Can take up another question, sir.
Yeah, sure.
What are the antimicrobials and antifungals which can be used in chronic relapsing skin conditions like ringworms and eczema?
To be very honest, see, for those of you who are attending to this conference in India, you have got amazing set of formulations, the classic Ayurvedic formulations in Kushta, Chikitsa, they are all, they all have all antimicrobial and antifungal. But for someone like me who is sitting here in London, trying to practice Ayurveda, I would have to really choose specific ones. Like for me, the anti-fungals that I use are like garlic, I use black pepper, I use olive extract, I use rosemary. And antimicrobials would again be, like all of our spices like cinnamon, I could use ginger, I could use black pepper again, I would use um, pipali, I would use trikatu. So for me, because we don't have a huge variety of choices to use specific formulations or specialized formulations of Ayurveda, I would have to think more like, okay, which is a powerful antifungal or a natural antimicrobial. But I think if you are practicing in India, you just would need to use the amazing formulations that are available within the Ayurvedic pharmacopoeia, and all the formulations which are used in Kushta Chikitsa, treating skin conditions. If you really go through the literature of them, they are all antifungal and antibacterial or antimicrobial actually.
We have another question like, how do you interpret Agni and gut microbes in the context of mental disorders?
Right. Okay. So that's an interesting question. See, there is a connection between gut health and brain functions. Okay. So again, those who are under chronic stress or those who are also under acute stress, this is what I also saw with COVID, is that some of my patients who were seeing me for a completely different condition before, after the lockdown, when it's been released a little bit, they came back with anxiety, which was never there in their life. These were high functioning people who never had experienced anxiety or even to some extent OCDs. And when I did their gut function test, what we could see was a very direct relationship between down regulation of their lactobacillus. So when the HPA or hypothalamic pituitary axis is affected due to increased stress, it actually down-regulates lactobacillus. And in a down-regulated lactobacillus situation, the gut would result in growing potentially pathogenic bacteria, which then would actually result in an improper neurotransmitter functions. Like if I can share this particular screen with you, I can show you in this report how you can see here, when I look at this neurotransmitter metabolism markers, what I can see here is there is excessive dopaminic activity, and that excessive dopaminic activity is resulting in poor conversion into epinephrine and norepinephrine. And this is very much related to the high fungal activity and high intestinal bacterial activity in this person, which is what it was shown. So there is a very close connection between our gut function and the functions, our brain functions.
Sir, I have one more question saying that about the gut microbiome evaluation you said. Are these tests done in India?
Yeah.
The,
Yes. I actually can say with confidence, because I work with Dr. Aravind Bagare, who is one of the ex JSS College teaching staff, and Dr. Aravind Bagare uses these tests for his patients, and this is all now also available in India.
okay. Sir, what do you think about the process of Agni or the state of Agni while using antibiotics post-operatively?
Oh, yeah. I mean, I'm sure the person who's asking this question clearly knows the answer. And I think it's an important point that this person has suggested. Obviously, that is the issue, right? So, surgery or parasurgical procedure, if they're given antibiotics, it completely upsets their gut microbiome. Almost we are creating a dysfunction in the Agni. And that is where the Agni needs to be corrected. Unfortunately, what happens today is amongst the general public who are experts of Google, they kind of go on Google and they say what to take for antibiotics. Once you have taken antibiotics, they get probiotics. And there are hundreds of companies which are making all types of probiotics. But what I've found in my practice is if you're not very careful with which probiotic you're using for that particular person, the gut functions become worse. Your Agni becomes worse. Because some individuals that I've seen in my practice, they are unable to respond to certain probiotics because of the amount of antibiotics that they would have been given throughout their life, that you then would have to really take them through very proper Dipana, Pachana to reset their Agni. And obviously that's an excellent question. I'm sure the person who has asked the question clearly knows that the answer is yes. Antibiotics is one of the most powerful destructive influences on one's gut functions. And also, as we know, the improper use of antibiotics, particularly, see, in the UK, nobody can go and get an antibiotic. Nobody, you would have to go through a GP, and very rarely you are prescribed antibiotics. And even if, but whereas I know in India, whenever I travel to India, if any of my fellow travelers have severe diarrhea, then I could go to a pharmacy and then they would say, yeah, okay, I'll give you amoxicillin or ciprofloxacin, whatever you want, so it's so easy, particularly in India, to get antibiotics even without prescription. And imagine how much the gut health could be compromised with undue or inappropriate use of antibiotics. Therefore, correcting the Agni becomes very important. And we know that antibiotics, the antimicrobial resistance is has become the greatest topic of research, where everybody is looking at Ayurveda and such other natural systems to see how to overcome antimicrobial this antimicrobial resistance. This is where I feel that one of the greatest contributions of Ayurveda is really using these very broad spectrum antioxidants and adaptogens, which also have antimicrobial potential, like Andrographis paniculata and others, which can do the job of killing the bacteria, but also not compromising one's immunity. So therefore, gut health and antibiotics is a very hot topic to consider.
So one more question we have. How fecal transplantation works in antibiotic insensitive foods?
It depends, like there are very strict indications for fecal transplant. If you go to a gastroenterologist who is specialized in fecal transplant, they wouldn't do fecal transplant only because it's possible. If they haven't responded to all other forms of treatment, that's when fecal transplant is done. Uh, in some cases where there is a very strict indication, fecal transplant does help. I have seen my own patients who have had long-term digestive issues before they came to see me. They had undergone fecal transplants. And I was very curious, like whoever has asked the question. So I kind of was, when following the cases, I asked, like, you have had fecal transplant and how did you feel? And this patient of mine said, yeah, I felt good for 3 weeks, but everything came back. So then what did you do? I went for another fecal transplant. So like this person was going through cycles of fecal transplant just to feel well. But as you and I can appreciate, that clearly was not the solution. Whereas if you take them through, properly building their agni, of course, you can use fecal transplant where it's an absolute indication. But then to use fecal transplant as the treatment every time would mean that it is abuse of fecal transplant, or it's not helping that person, because you're not really changing the host environment. To change the host environment, we would have to deal with food, we would have to deal with lifestyle, we would have to do shodhana, we would have to get back to eating healthily, and also to use the amazing range of Ayurvedic formulations that are there, which can help in improving one's health.
Sorry, I got this question, sir, saying that what is the role of pre and probiotics in the state of Agni, increasing or improving the state of Agni?
Yeah, sure. I mean, as you may all know, that prebiotics or the fiber that would help in creating the healthy gut microbial flora as it becomes the food for the microbes. And what I have found is fiber is the best thing, and soluble and insoluble fiber. Of course, that sounds like, yeah, okay, then let's give fiber to everyone. But the truth is, those who have a very poor digestive health or digestive issues actually respond very badly to fiber. Like when they have fiber-rich food, or even if you give them fiber, like let's say isabgol, which is psyllium husk, they bloat. They have this abdominal discomfort because you may have heard of FODMAP, which is fermented oligo monosaccharide, FODMAP diet, low FODMAP, like in IBS. Some actually respond much better to low FODMAP, where actually fiber becomes an important factor. So some do not respond well to fiber, others respond well to fiber. Hence why, you would have to be very careful when you are giving prebiotics. As much as you have to be careful while choosing the right kind of probiotics as well. And I feel that, very simple things that we have in Ayurveda, like Bhojana, Grace, Sadapatyam, Lavana, Adraka Sevanam, is quite a fantastic concept because, Ardraka is fresh ginger, it's not the dry ginger, and it is full of fiber. And then having just this little bit of fresh ginger with salt, it can be a fantastic thing to act as a probiotic. Like Ayurveda has so many Ayurvedic ways of eating, has so much of these concepts which they probably did not know, but they had the experience of using these prebiotics and also, probiotics. We have so many of these aranala and all the fermented preparations. So there's so much of science in Ayurveda, which is quite fascinating. The simple Ayurvedic ways of life to increase prebiotic consumption. Ginger is a great prebiotic. Triphala is a very good prebiotic.
One more question about the operative related condition. The pre-operative shodhana can this pre-operative shodhana can help in increasing the anti?
Yeah, definitely. I mean, it definitely does. Yeah. You see, in my postgraduate research, I was working at Kidwa Institute of Oncology, and there were oncologists and also Dr. Kumaraswamy, who was the Ayurvedic head within the oncology unit then. And we had amazing, great conversations. One of the things that we were trying then was to do a Lagu Virechana or a mild Shodhana before surgery, before chemo, before radio, and also post. And what we found was there was such a huge or a significant reduction in adverse effects, complications, and also the secondary infections or even infections reduced hugely in those who underwent Shodhana before Shastra Karma and after. Like same concept of Sushruta, who says that you would have to, the treatment is a continuum. Shodhana, Shamana, especially when you're dealing with difficult conditions. Yes, the answer is yes. It's an absolutely useful way to treat.
Thank you, sir. Thank you for all your thank you for your sharing all your experiences and for your wonderful time you have shared with us. I'm sure everyone listening and seeing this are very happy. I request Principal Sir to please conclude the session.
Thank you. Thank you so much.
Yes, Dr. Vijendra. Hello.
Hello.
Namaste, Dr. Vijendra ji. Namaste, Dr. Sarveshwar.
Namaste.
I am listening to you. Whether I am a student for you now, some while. Really, we thanks our entire team for a great cause. This knowledge is shared. Money also in welcome. I was mentioning this, whether you are there or not. This webinar was planned or organized as a salutation, as a gratitude to the Rajendra Swamiji, which is we have now 150 joint celebrations. So he stood for three reform in the society. One is Anna Dasoha, feed the hungry people around the globe. The second one is Aragya Dasoha, give the healing touch, whatever best can be done, what we are doing today. And third one is this is Akshaya Dasoha, share the knowledge. So this platform is created, and both the HODs are very vibrant. Dr. Sideshji and Dr. Goimat, Shivanand Goimat, today is not here in this program. And you have accepted an invitation, Dr. Vijendra. We know you as a Vijendra. fine. It is Vijay Murthy Clinic at UK. On behalf of all the listeners, knowledge, those are seeking the knowledge, we thank you, Dr. Vijay, and also we invite you, when you are coming to the hometown, please visit this campus. This is the Serene campus, having 15 acres land, foothill of Chamundi Hill. And this institution is 25th year. So if COVID-19 is not having a block, you are landing in somewhere in India, please visit to this campus. It's a invitation to you.
Sure, thank you.
And also the knowledge you shared, it was what you call as the latest update you are giving to the entire fraternity. It is worthy to mention that this knowledge is what exactly that Susto was talking about 3,000 years before, and you are talking from the land of knowledge, that's called UK, in contemporary science. My HOD is sitting with me, Dr. Siddhesh. We want to thank you also.
Thank you.
Thanks to all these participants and delegates, teaching faculties. We are expecting that same zeal should be there for tomorrow, and it is a 5 days program. Dr. Bijendraji, also I request you in the future to take over our PG students on maybe an Agni or whatever best you feel. Thank you.
Okay.
And Dada, namaste.
Namaste.
Namaste. Your speech was very thought-provoking and excellent, brilliant speech you have done. And what you have thought, it is now we are thinking about in this way. It's a very new and latest updated knowledge. We never thought about in this way. And when you send the subject topic at that moment, we have little bit confused. Then later we thought that let's talk. It may be the new invention we'll adopt in our practice. We thought that, and then send the okay message. Then after hearing your lecturer or speech, it is very nice and thought-provoking. We will also think in this way, and then we will adopt your what you have done your so far, the research work, your views in our surgical practice. Thank you very much on behalf of JSS Ayurveda Medical College and Shella and Shalakya Department. Thank you.
Thank you. Thank you once again.
Sir, can you please share your email ID? One of the participants is asking.
So I'm just gonna send it to everyone. So you have it. It's hello@murthyclinic.com, murthyclinic.com. And my website also I'm sharing, which is www.murthyclinic.com. Yeah.
Let me share it, sir.
Yeah, I've shared it on the chat.
Dr. Vijendraji,
Yeah.
I remember the time we have spent at Bangalore.
Yes.
With a good company. So now that inspiration has made you to reach your this stage. Thank you to everybody that who made you to reach to this stage. Maybe your teacher or maybe your well-wisher, your parents. I have a special salutation to all of them. Thank you.
Thank you, Dr. Sarveshwar. I have a very close connection with Dr. Sarveshwar and Dr. KP. They are my very good friends for a very long time.
Thank you. Thank you very much. Thanks. Namaste.
Okay. Yeah. Namaste. Yeah. Namaste, everyone.
Only namaste is existing, Dr. Bijendraji. There's no handshake now. So I think you remember when I was joined PG, when I was touching the feet and doing namaskar, that time everybody said that, oh, you have to, where you have come? You have to do handshake here. You have to, namaste does not stand here. When I came to Bangalore joining PG, so that was, I did not left out what was my culture, Vijendraji, now the same namaste is existing. Thank you very much.
Yes, of course. Yeah.
COVID-19 has made it more compulsory rather than it's a tradition to the world now. Namaste.
Yeah. Yeah.
Thank you.
Actually, there is an amazing Italian song called Orientalis Karma or Oriental Karma. If those of you are interested, look it up. It's an amazing song, and there are so many namastes in it. And I love that song.
Thank you. Thank you. In this short notice, Dr. Vijendraji, you have spent your valuable time for the purpose of science and also purpose of this fraternity. And we are really grateful and thankful to you. And again, I'm telling, this is a great occasion, auspicious program for us because this knowledge is a salutation on the lotus feet of Param Pujya 105th joint celebration of Rajendra Mahaswami. And again, you are from Karnataka. That's again because you are the Manedu Maga Altaralwa. So that that feeling, that our former Prime Minister, everybody is speaking, it is always I hear that Manedu Maga. Manedu Maga, okay, fine, sorry. I'm correcting. I learned Kannada from you also in the Sekar Hospital. Okay. So that still I'm continuing. I have to learn a lot more. So you are the Manedu Maga means you are the what you call proud product of where the Sandalwood Bridge is moving or flowing, where the Kaveri water is flowing, and where the Bishivara bath they eat as a wholesome food. Okay, you are talking about the cereal, then you are talking about this pulses. The best is carrot for my eye and your eye. Then it is tuppa, that's geese, cow's geese, and served with hot. So no microorganism. The gut will be completely healthy. That's a, it is not belebath. It is a bishi belebath, Vijendraji. So that I could see that vibration with you, taking the Sandalwood Bridge here and drinking Kaveri water and having Vishubara bath and that Mysore pak.
You didn't mention Ragi Mudde.
Yeah, Ragi Mudde. Yeah, you have to mention that one. That is my former Prime Minister. Today also it is in the his this, and when he was in the Prime Minister, he took a special cook from the that belt from Ashan to the his PM Bhavan. He was taking that ragi mudde. Yes, ragi mudde.
I don't know if you remember, my parents' place, which is our family home, is close to Deve Gowda's home, Padmanabhanagar.
Yes, you have shown me. I have visited your home, I think 2-3 times. You have given me all the traditional food also, including Obatu, Holege. That I forgot to mention that Holege is the traditional food here.
Yes, yeah. Okay, Dr. Sarveshwar Kar.
Thank you very much. Namaste. Thank you.
Thank you.
Thank you, sir.
Thank you.
Dear participants, we shall end day 1 scientific sessions by now, and hope to see you all tomorrow morning with the day 2 scientific sessions 2, where we have 2 more speakers. Dr. Hemant Kumar from NIH Jaipur will be talking on utility of Rakta Mokshana.
Very senior most and professional.
And Dr. Samudri of Gadag will be talking on non-surgical management of Tundi Keri. Thank you all. Hope to see you all tomorrow morning. Thank you.